Greetings and welcome to our program tonight, Cultivating Men of Distinction, addressing the social determinants of health for Black boys. Before we start our program, we need your help. We ask that you at this time would scan the QR code that's on the screen and fill out our pre-activity assessment. It'll only take you a couple of minutes, and we'll tell you a little bit about the All of Us research program. This pre-activity assessment is to establish our baseline for understanding research and the All of Us program. The assessment takes about 2 minutes, so we need your help. Please fill out our pre-survey link. As you are coming in, if you're just joining us, we're asking you to take just a couple of moments to scan, or you can click on the link that's in the chat, our pre activity assessment. This survey only takes you about 2 minutes, and there's some valuable information that we need from you. Also, I'm going to ask you to hang with us throughout the program, and at the end of the program, we will have a post activity assessment also for you to complete. So we need you on the front end as well as the back end. So it'll take you a couple of minutes. So now let's learn a little bit more about the All of Us research program. Next slide, please. Good evening. I am Arthur Gregg, and I bring you greetings from the Black Greek Letter Consortium and the All of Us research program. The first step to understand is to understand the concept of health research. Research is the process of finding out new things. Health research is the process of finding out new things about improving people's health care. Did you know that the majority of health research has been conducted with middle-aged Caucasian men as the participants? Hmm. This means that the medicine or treatment resulting from the research is designed specifically for that demographic. Communities who are underrepresented in medical research then are at risk of experiencing negative responses because it's not to the best for their body. Going forward, we need to do a better job of including all types of people in health research. The only way we can fix this injustice is with your help. Next slide, please. So, what is the All of Us research program? I'm glad you asked. The All of Us research program, led by the National Institutes of Health, that's working to improve health care through research. Unlike research studies that focus on one disease or one group of people, All of Us is building a diverse data set that can inform thousands of studies on a variety of health conditions. It is a longitudinal effort to gather data from 1 million or more people living in the United States to accelerate research and improve health by taking into account individual differences in lifestyle, environment, and biological makeup. All of Us is the largest and most inclusive health research program ever. Next slide, please. We're all different, right? But when we go to the doctor, our treatments are often the same. Your healthcare and treatment should be tailored for you. This is called precision medicine. Precision medicine is a new approach to improving health, treating disease, and finding cures. It acknowledges that a one size fits all approach to medicine isn't the best because we know that what works to treat me may not work to treat you. Each person is different. Factors that greatly impact our health are our genetics, our lifestyle, and our environment. Ultimately, precision medicine can produce more accurate diagnosis, early detection, and better prevention strategies and treatment choices. So, what are some examples of precision medicine? There are things like prescription eyeglasses, blood transfusions, insulin pumps, and hearing aids. And I always think about prescription eyeglasses. I'm a person who likes eyeglasses. I really like frames. And so I'm always asking people, hey, let me try your glasses on. And the frames may look good, but guess what? The lenses are always off. Why? Because those lenses weren't created for me. They were created specifically for that person. Imagine what healthcare would look like if we had more precision medicine. Next slide. So, a growing body of research shows that centuries of racism in the United States has had a profound and negative impact on the communities of color. The impact is pervasive and deeply embedded in our society, affecting where one lives, learns, works, worships, and plays, and creating inequities in access to a range of social and economic benefits, such as housing, education, wealth, and employment. These conditions, often referred to as social determinants of health, are key drivers of health inequities within communities of color, placing those within these populations at greater risk for poor health outcomes. And that's from the CDC. So, wow, that's why we're so glad that you're here tonight, because that's what we're talking about. So, here's the part where you become true participants. Now, this is where we really need you to hang in there with us. We need your help here. So, if you pull out your phones or go to and go to your Google Play or Apple App Store and find the All of Us Research app. Visit the All of Us Research, All of Us website at joinallofus.org/together. I'm gonna give you a few minutes to do this. There, you can learn more about the program or choose to sign up if you're ready today. Or you can download the All of Us Research app in the Google Play or App Store or Apple App Store. You may notice that there are two All of Us apps in your App Store. Please be sure to download the one named All of Us Research with the all white background created by Care Evolution. Note, the All of Us app can be downloaded on your computer, your phone, your app, your tablet, etc. So I'm giving you a few minutes to do that. I know you're pulling your phone out, or you got your tablet, or you're at your computer. So if you would just take a few minutes and tap on and just click on that and find that joinallofus.org/together. Now, once you've done that and you've clicked on it and you've looked at it and you've created your account, you'll be asked to give your consent. This includes reviewing a series of videos which will provide more detailed information about the program. These describe all the types of information you may be asked to give. And then once you feel more comfortable that you know what to and that you know what to expect, and if you are ready to give your consent, you'll electronically sign the consent form. You can do all of this from your computer, tablet, or smartphone, or at a partner center. You may also elect to share your electronic health records, which is a digital version of your medical chart, and complete the consent for DNA results. You will be asked to answer several health surveys in combination with other health information. The answers provided in these surveys can be researchers identifying patterns about how our lifestyles and backgrounds affect our health. After these initial steps, you may be asked to share your physical measurements and provide your biological samples so that the program can help researchers better understand how different factors, including our genetics, make our participants unique. Now, this is your call to action. Go to the site, locate the Join Now button to create your account, and know where to come back. If you decide you want to come back later and ready to become a partner. Also, if you're in the New York area, you can click on the link that's being placed in the chat to learn more about the New York enrollment process. So, who's got their phone? I know you're on your phone. I know you're going and you're going to click on that process. At this time, I am going to introduce you to our moderator for tonight. I know you're excited. Oh, before I forget, let me tell you about our awesome research convention that's coming up. On March 31st, 2022, the Minority Student Research Symposium, or the MSRS, invites students who are members of communities underrepresented in biological research to complete a research project of their choice using data from the All of Us Research Program Research Hub. Students will be paired with a STEM industry mentor to prepare a research poster and present it during the virtual symposium. I was there last year. It is amazing. Greater participation of all racial and ethnic groups is needed in biomedical research. Underrepresented minorities represent over 30% of the US populations, but less than 9% of STEM PhD members and 7% of all physicians. We know that diversification of the biomedical workforce will help address the critical need the US faces to reduce racial and ethnic health and healthcare disparities. You don't want to miss this program. Now, I get to introduce you to one of my brothers, someone who is an awesome member of our team who is going to moderate this awesome panel. Brother Dr. Eric Christopher Webb is the fraternity's director of communications and editor of the Sphinx magazine. He also serves as Alpha's All of Us social media coordinator. He is a National Black Authors Tour best-selling author of 5 books, including the critically acclaimed Love Letters, Death Threats, and Suicide Notes, and the 2013 Phyllis Wheatley Book Award for Best Fiction Finalist, The Garvey Protocol, inspired by true events. An award-winning journalist, poet, and educator, Brother Webb is a former Washington News correspondent for Thompson Newspapers, written for numerous other newspapers, contributed to several journals, anthologies, and magazines, and taught English and journalism at the Graduate School, USA, Prince George's Community College, Temple University, the Alternative Learning Institute, as well as other schools and institutions. Called a gifted visionary wordsmith by Essence Magazine, whose work shakes up status quo by the Washington Post, he speaks, performs, and conducts personal and professional development workshops at universities, colleges, conferences, and corporations nationwide. He has been featured in or on the Washington Post, the National Newspapers Publishers Association Newswire, Essence, HBO, BET, The Learning Channel, Sirius XM, Voices of America, and a host of other shows and networks. Brother Webb is a 1989 New Chapter Initiate of the fraternity, life member, and member of Rho Tau Lambda Chapter. In addition, he is also a 1991 English and Journalism graduate of Lincoln University with numerous awards and fellowships from Howard University, Harvard University, Ohio University's E.W. Scripps School of Journalism, the Freedom Forum, the Associated Press, the Scripps Howard Foundation, and the Investigative Reporters and Editors, Inc. To all, meet Brother Dr. Eric Christopher Webb. Man, you have been really busy.
Thank you, good brother. Good evening and welcome, everyone. My name is Eric Christopher Webb, as was mentioned, and I am the moderator for tonight's amazing discussion on cultivating men of distinction, addressing the social determinants of health for Black boys. Now, at this time, I would like to introduce Frater Nassim Ashford, who will provide an overview on the social determinants of health. Frater Nassim Ashford is a native of Atlanta, Georgia, and is a current MPH candidate at the Yale School of Public Health, concentrating in social and behavioral sciences. Nassim received his Bachelor's of Arts degree in Global Health and Global Development Studies with a minor in anthropology from Mercer University. After graduating, he participated in the Congressional Black Caucus Foundation's Emerging Leadership internship program in Washington, D.C., where he served in the office of Representative Karen Bass. Currently, he is in the CDC's Public Health Associates program, where he conducts COVID-19 infection and disease surveillance for the Richmond City and Henrico County Health Department. Naseem is passionate about health advocacy and education, minority health, and health policy. He plans to pursue a career working both domestically and internationally to improve healthcare practices and promote overall health equity for those in need. Ladies and gentlemen, Frater Naseem Ashford.
Thank you for the warm introduction. Again, my name is Naseem Ashford, and I am a master's student at the Yale School of Public Health, concentrating in social and behavioral sciences. I am also a member of Omega Psi Phi Fraternity Incorporated, where I crossed at the mighty Gamma Zeta chapter at Mercer University. Today, I'm here to discuss the importance of social determinants of health in regards to Black men and boys. Next slide, please. So first, I'm going to talk about what is health, and then what are the social determinants of health, followed by the domains of health, and lastly, why social determinants of health matter. Next slide, please. According to the World Health Organization, health is the complete state of physical, mental, social well-being, and not merely the absence of disease or infirmity. Next slide. So what are social determinants of health? By definition, social determinants of health are the conditions and places where people live, learn, work, and play, and how it affects their overall quality of life. Next slide, please. Examples of social determinants of health include housing, community, access to health, childhood experiences, employment, social support, education, and family income. These factors affect our everyday lives. Therefore, everyone is impacted by social determinants of health. Next slide. These factors also make up the 5 domains of health, which are the neighborhood and built environment, healthcare access and quality, social and community context, economic stability, and education access and quality. This graph here shows the percentage of factors that impact an individual's health. 40% of health is attributed to social economic factors, while 10% is attributed to physical and built environment. 30% is attributed to health behaviors such as diet and exercise, sexual activity, and alcohol use. And 20% is attributed to an individual's access and quality of care. Next slide. The first domain of health reflects the connection between where a person lives and their health and well-being. It includes key issues such as access to healthy foods, quality of housing, crime and violence, and environmental conditions. Next slide, please. The neighborhood and built environment barriers that affect health can include access to parks, lack of transportation, and food deserts. Housing barriers affecting health can include poor water quality, poor air quality, lack of air conditioning and heating, and other structural issues. The second domain of health reflects the connection between a person's access and understanding of health services and their own health. It includes key issues such as access to healthcare, access to primary care, and health literacy. Next slide. This graph here from the National Center of Health Statistics looks at the life expectancy at birth for all men, and more specifically between white men and Black men. African American males have the lowest life expectancy and highest mortality rate among all men and other racial categories within the United States. In 2017, the average life expectancy for all men was 76.1 years old, and for white men, it was 76.4 years old. And lastly, for Black men, it was 71.9 years old. This shows us that in 2017, there was a 4.5-year difference in the mortality between Black and white men. And as you can see, historically, the data shows that Black men had a lower life expectancy than their counterparts. This can be attributed to the lack of insurance, provider availability, cultural competency, and medical bias, which all determine the quality of care an individual receives, and which is often impacted by race. Next slide, please. The third domain of health reflects the connection between a person's social environment, such as social support, family structure, community engagement, and their overall health and well-being. This includes key issues such as incarceration, racism and discrimination, mental health, and stress. For example, Black boys make up 1/3 of the US incarceration rates, and in a broader context today, Black inmates make up 40% of the US population compared to only being 13% of the population. The criminalization of Black boys is due to racism and discrimination, which leads to increased instances of police brutality. And over time, these actions affect the mental health of Black boys and their self perception of and their identity. These factors disproportionately affect Black boys and their health as they become adults. Next. The fourth domain of health is economic stability. It reflects the connection between a person's financial resources, such as income, cost of living, and socioeconomic factors in their health. Economic stability can affect factors such as healthy access to foods, educational attainment, housing quality, and emergency resources. Next slide, please. This graph shows the national earning disparities relative to white workers in the United States. According to the data, Black households per dollar earning is 76 cents compared to $1 for the white household counterparts. This income disparity that Black households face contributes to poverty, housing instability, and increased stress on the Black family. Next, please. The fifth domain of health is education, access, and quality. It reflects the connection between aspects of a person's education and health and overall well-being. Next, please. Health benefits of education include better jobs, higher earnings, reduced stress, better resources for good health, and increased positive social networks. People with higher levels of education are more likely to be healthier and live longer. So, why does it matter? African American boys and men are among the most underserved populations in the United States in regards to healthcare access and quality of mental health services. Previous research relating to African American men often focus on individual behavior factors but do not take into account the social determinant of factors impacting their health. Addressing social determinants of health is important for improving health and reducing long-lasting disparities in health and healthcare quality. With all of this in mind, it is important to understand that social determinants of health is important to incorporate within solutions and interventions geared towards improving health situations of Black men and Black boys. Thank you.
Thank you. Thank you so much, Frater Ashford, for that very informative overview on the social determinants of health. Now, I'd like to introduce our three very distinguished panelists, and I'll do that collectively, and they are Brother Kevin Mundy. Kevin Mundy is the executive director for the Project Still I Rise Incorporated. He has worked in the field of philanthropy and community development for the past 20 years. Kevin is a strong advocate for social change and education. Throughout his career, he has helped organizations and institutions recognize their unique capabilities to help organizations. Excuse me. Throughout his career, he has helped organizations and institutions recognize their unique capabilities to service the community. Kevin has a contagious enthusiasm and passionate belief in people that inspires them to become servant leaders, agents of change, and more valuable contributors to society. He has also led innovative initiatives to bring about positive change and awareness to our communities. Kevin received his Bachelor of Science degree from East Central University and his Master's of Arts degree from Dallas Baptist University. Kevin is a proud husband and father. His mantra is a quote by Shirley Chisholm and Marian Wright Edelman: "Service is the rent we pay for living on this earth. It is the very purpose of life and not something you do in your spare time." Welcome, Kevin.
Thank
Now,
you.
Brother Jeffrey Okonye, Brother Dr. Jeffrey Okonye was born and raised in Houston, Texas. He earned a Bachelor of Science degree in neuroscience at the University of Texas, Dallas, where he joined Alpha Phi Alpha Fraternity Incorporated. He went on to earn his Doctor of Medicine degree at the University of Texas Southwestern Medical School. Afterwards, he completed a pediatric residency program at the University of North Carolina Children's Hospital. He is currently completing a pediatric emergency medicine fellowship at Emory University. His interests include medical simulation and improving health equity. Welcome, Brother Akunye.
Thank you. Thank you.
Next, Soror Dr. Carsonia Wise Whitehead. Dr. Carsonia Wise Whitehead is an associate professor of communication and African American studies at Loyola University and the founding director of the Carson Institute for Race, Peace, and Social Justice. She is the host of the award-winning radio show Today with Dr. K on WEAA 88.9 FM and 2021 recipient of a regional Edward R. Murrow Award for Excellence in Diversity, Equity, and Inclusion. Dr. Whitehead also writes a bi-weekly column, Conversations with Dr. K, for the Afro-American newspaper. She is the author of 4 books, including Race Brave, New and Selected Works, Notes from a Colored Girl, The Civil War Pocket Diaries of Emily Frances Davis, which received both the 2015 Darlene Clark Hine Book Award from the Organization of American Historians and the 2014 Letitia Woods Brown Book Award from the Association of Black Women Historians, and also Letters to My Black Sons, Raising Boys in a Post-Racial America. Welcome, Dr. Whitehead.
Thank you so much.
Well, we're in for a very intriguing dialogue from these very distinguished panelists. So, audience members, I would ask that you please put your questions and comments in the chat, and we will address them later during our program. So now I'm posing a question, and we're getting a little bit of feedback, I think. So I'd like to pose this question. It's a brief question for a brief response to all the panelists, and that is, why are some of the current challenges of addressing disparity? What are some of the current challenges that you see of addressing disparities in our community? And
Well, I can say,
okay, jump right
I'll
in.
go from a medical standpoint. I think the issue is, and we talked about it in the previous presentation, just like, cultural competency. Unfortunately, there aren't a lot of doctors that look like us. And I think that creates tension between patients and doctors. And you have a power struggle where they're kind of afraid to speak up for themselves at times. And then you have physicians who don't understand the culture of the patients that they're treating. So, I hope a program like this empowers people to speak up and ask questions. It also forces doctors to look at themselves and ask, do they truly understand what's going on with their patients and what things contribute to their illnesses and what brought them to their practice that day, versus just thinking of that, everything works for everybody mentality.
Thank you.
So as I think about it in terms of our disparities, I'm reminded that given that today is the day that we are celebrating and thinking about and reflecting on the life and legacy of Reverend Dr. Martin Luther King Jr., a member, of course, of Phi Alpha Fraternity Incorporated, he noticed that there were 3 evils. That the same evils he talked about then are the same evils we're facing today. One is the evil of racism. There's a lack of critical race theory and analysis in talking about the racial state of the legacy of prejudice and racism and white supremacy in this country. And until we wrestle with that, until we're honest about what it means to be Black in a white world, we'll always have that evil with us. Until we force those who would rather erase us to deal with what it means to be a part of this country and to sit at the table and demand equal justice, then that evil will be with us. The second evil he talked about was the evil of classism, poverty. We know there's a wealth pay gap in this country. We know that for the average white family, the net income is $171,500. And for the average Black family, the net income is $17,500. So poverty is an issue that we're dealing with, given the fact that the 10 richest men in America are all white men, and they quadrupled their income during this pandemic. They went from $50 billion collectively to $1.5 trillion collectively. Poverty is a whole that we have to deal with. And the third evil he talked about was the evil of militarism. Now, we can talk about that internationally in terms of the armed services, or we can talk about it domestically. What does it mean to have this really fraught relationship with police officers in our community, that we're still talking about the justice we want to have to be safe, to be protected in our own communities, in our own skin, and in our own schools? So I would say some of the disparities are the same evils that Dr. King laid out. He was ignored then. So perhaps today we can recognize that and fight against them.
Thank you.
Thank you. Everything has been said very well, but I would like to say there's two things. One is acknowledging, two is addressing. We have to acknowledge what those disparities are in our community that impact us. And I would just like to say for the record, I am a participant in the All of Us study. I am a participant in the All of Us study. And how I learned about it was I was in the community at one of our local health and rec centers. And there was this big trailer that said All of Us. And someone educated me on what all of us meant, what it could do for not only me, but for generations to come. So I acknowledge right up that we have some health disparities in our community. I have some health disparities in my family. So it became important to me to be a part of this research, because there is someone who may have my same genealogy or makeup, including my children, that could benefit off the research that is done on me. So the research that I'm undergoing could potentially save lives for generations to come. Secondly, we cannot be afraid of research. We get in our cars every morning and we pull out our cell phones and we have something that's called predetermined data analytics. So you'll pull out your cell phone and your Waze or your Google Maps app will tell you where you're headed and how long it's going to take you to get there. So research is being done on us whether we like it or not. So let's use the tools and resources with science and research that are being made available to us to help us live healthier and successful lives.
Thank you so much. Fred or Astrid, do you have any comments to add?
I definitely agree with everything that has been said. Research is really important because it allows us to see the vast majority of the issues that are going on within the community and compare it to different communities and see the health disparities that are present.
Okay, great. Thank you so much. So this next question I'd like to direct to Dr. Whitehead. How are Black boys seen in our current social economic climate? And the follow-up to that is, what can we do to prepare, protect, and also propel them?
Thank you for this question. I think about this a lot. In my book, Letters to My Black Sons, Raising Boys in a Post-Racial America, I outline what my husband and I have done and are doing to raise our sons to be happy, healthy, whole, and to be able to spark the genius that Dr. Carter G. Woodson talked about that rests inside of them. So I'm going to answer part 2 of your question first, because I think that when you talk about how they're seen, we all have an image of how Black men are seen. As I sit here on a panel with all young Black geniuses, you know what it means to be profiled in this society. So let's start with part 2. What can we do to prepare them, to protect them, to project them out into the world? What do we do when we want to unleash what is inside of them, the brilliance that rest inside of them, when we set them forth and set them loose to set the world on fire? What does that look like? I talked today on my radio show about this idea of doing excavation work. Like my dad said, that when you show up to dig out the genius that rests inside of our children, you got to show up in work boots with a pick on your back, roll up your jeans, roll up your sleeves, and dig inside of them to get out the dirt, the dust, and grime that this society has placed on them. They've been told that they are losers. They've been told that they're less than. They've been told that they don't have a place at the table. So part of the work we do, we show up to dig that out of them, to get inside of them, and to think about what it means to spark their genius, to figure out what moves them forward, and then to be the wind that is behind them. We would often tell our sons that we have two roles here as your parents and as your protectors and as your providers, as your cheerleaders and as your supporters. We are supposed to stand in front of you, facing the world when they're coming after you. Our job is to be between you and the world until you're able to stand on your own. When you are right, we face the world. When you are wrong, we turn around and face you. Because part of knowing when you're wrong is helping you to figure out how to get right. Now, both my sons now are in college. I have a college junior who's down in Memphis, Tennessee, in the belly of the beast of Southern racism. And I have a college first year who's up in Pennsylvania dealing with the belly of the beast of Northern racism. But both of them have been prepared. Both of them know how to speak up, how to advocate for themselves. Both of them understand, like Dr. King said, it is hard for a man to ride your back when you're standing up tall. We've taught them how to stand up tall. And then finally, which I think is really interesting because, Dr. King is a pastor and my daddy's a pastor. So I often relate back to that. But I remember a story that my daddy said in terms about how do you dig deep, that when the disciples were on the water and Christ was standing on the shore and he yelled out and said, "Have you caught anything yet?" And they said, "We haven't caught anything yet." He says, "Go out a little bit deeper and drop the net on the other side." Sometimes we don't think we're getting through to our young men. We got to go out a little bit deeper and drop the net on the other side, teaching them that there's not just one path to genius. It's not just the basketball. Someone's got to work the contract for the players. It's not just the football 11. Someone's got to figure out the diagram for the engineers. It's not just how do you run up and down the field. Someone's got to lay out where you're running to and how you're going to get there. Teaching our boys there are multiple ways that you can contribute. And then finally, it's back to Dr. King, because I've been thinking about him all day. He told young boys and young girls when they were 10 and 12 years old, he said, "Look, I need you to go out and march." He said, "Because what you're doing today will have an impact on children who are not yet born. Let's teach our boys that what they're doing today will have an impact on children not yet born, that they're part of building all of us up and moving us forward."
Thank you so much, Dr. Whitehead. My next question, and this is for Mr. Mundy. How does the neighborhood and built environment affect the lives of these boys, and how does it connect to their health?
A great question. So there was a study done by Kaiser Permanente, which is a large insurance company, and it was conducted in conjunction with the CDC. What they wanted to measure was ACE, adverse childhood experiences, to link to negative health outcomes. And there were a set of community risk factors that was identified in this study. And those risk factors were communities with higher rates of violence and crime, communities with higher rates of poverty and limited educational and economic opportunities, communities of high unemployment rates, community with easy access to drugs and alcohol, and communities where neighbors don't look or look out for each other, communities with fewer community activities for young folk, communities with unstable housing, and where residents move frequently, communities where families frequently experience food insecurities, and communities with high levels of social and environmental disorder. Now, we can look at any data set across the country, and you pretty much can drop that data of what these community risk factors are, and it will land in a predominantly African-American community or neighborhood across the country. So what they did, they looked at those risk factors and said, if there was a kid or an individual who had one of those risk factors, it was already predetermined they could link that to a negative health outcome. So when it relates to African American men and boys, Brother Nassim did an excellent job of outlining what African American men life expectancies are. You know, we're 71, an average of 71 years of age, with a 5-year gap in between the next race. And you look at what has unfolded over the last 2 years with the racial and social injustices, where our young men of color are looking at individuals on live TV being killed or assassinated or murdered by police officers or regular citizens. You cannot help but to link that to negative health outcomes. There's another project, it's called Project 100, where if you would only imagine if every African American male, young boy, had at least $100,000 of life insurance on them, at least $100,000 of life insurance, we can begin to see more people get involved with reverse engineering some of these community risk factors, because the answer is already there. We just have to reverse engineer what those risk factors are, because as more and more people, you know, pass away, right now it's like nobody really cares or pays attention because it's not impacting them economically. So, but if you look at how many people were murdered last year that were African American men, and if at least they had at least $100,000 worth of life insurance, we would see the major life insurance companies say, we need to step up, we need to get involved in these communities where we have all these community risk factors, because we have paid out over $22 million in claims just in policies alone. So we have to get involved on the ground level and begin to start reverse engineering some of these community risk factors, where it could always be as easy as teaching financial education inside of some of the homes where we see there is a disparity gap of income and savings and lack of financial education. Or we can ensure that communities are where young boys of color are living in a stable environment, or we can ensure that they have access to a high quality, high engaging preschool to give them the start that they need.
Thank you so much. Thank you so much, Mr. Money. I kind of cut off abruptly. I wasn't sure if you were finished.
Yes.
Let's go to Dr. Okonye. What are the proactive steps that parents, guardians, grandparents, and grandparents can take to ensure better healthcare quality for their boys?
So one thing I want to point out, for sure, if anybody remembers anything that one thing I said, that I think if you have children, you need to write down this website, healthychildren.org. Is the site powered by the American Academy of Pediatrics. And essentially it's a site built by pediatricians that will help you establish a very healthy foundation for your children. And so where it comes to our Black boys, the very important thing is establishing a medical home. Unfortunately, like Brother Manu pointed out with the ACEs study, a co-fellow of mine did a study in which it showed that children who have a lot of ACEs basically present more to a pediatric emergency room than they do a primary care physician. The problem with that is us in the emergency room, our objective is to help you in an emergency and either admit you to the hospital or get you home. The reason you need a primary care physician is because this is the person that gets to know you. It gets to know your family, gets to know what like your makeup is, gets to help tailor care for you, gets to point you in the direction of what other physicians you need to know. That is why it is so important for families to establish a primary care physician for their children, Black boys especially, because even if you can't find a physician that looks like you, there are physicians who are compassionate, physicians who are, they're going to ensure that you're doing the right thing for your family, doing the right thing for your children. They can point you in directions to give you the correct resources. And it's just showing you how important it is to have a very healthy foundation. That being said, as parents, grandparents, aunts, uncles, caregivers, it starts with you. Us as physicians can only tell your children what to do if you aren't doing it at home. We need you to look at resources, listen to, what's going on these websites, figure out healthy ways that you can change your life. That way you can impact your child's life. And then, pointing out what, Dr. Whitehead was talking about, and Brother Mondi, and our frater down there, about just the different social determinants of health and how it affects our Black boys and mental health. In these times today, it is very important for you to ask your Black son, how is he doing? I had a patient not too long ago, 16-year-old male, depressed. Couldn't even tell me what's going on. He's in the emergency room, depressed, thinking about killing himself. And these are the things these are real conversations that we have to have. Asking your kids, how are you? What is going on? What are you thinking about? Gone are the days where you can hide certain news from your children, think they're not going to be exposed. The way social media is today, your child may know about things before you do. They may learn about the next killing of a Black man before you do. And that's why it's imperative that you are active in your child's life and you're talking to these boys, letting them know it's going to be okay, and asking them how are they feeling. Honestly, getting them to talk about their feelings and not letting society tell them who they need to be and how they need to act. You need to be the person in their life guiding them, helping them know that they have resources out there. And if they're not feeling well, they have a pediatrician they can go to. They don't always have to go to the emergency room because it's an emergency. There are physicians that you can see when it's not an emergency to make sure you are still healthy.
Thank you. Now, you've touched on this somewhat, but Dr. Whitehead, from a social justice perspective and your perspective as a mother, what are your recommendations on what individuals, parents, educators, mentors, and families can do?
So I think that's twofold but connected, because I do believe that in order for us to raise our young boys to be the geniuses that I believe they can be, that it does take all of us pouring into them. It's not just the work of the parents, it's also the work of the community leaders, and it's also the work of the teachers, and also the work of young Black men and older Black men who come in contact with the next generation. I think we can begin to drill down deep into a few areas. One is to think about education. I encourage parents to be more actively involved in what their child is learning. This has been a very difficult time during the time of the COVID pandemic. The children who lost in terms of their lessons, it happened within the Black community, particularly economically challenged Black community, where there was lack of access to technology, where we had students learning with pen and paper, while other students in more advanced schools were learning with computers. So we've seen that drop. So I'm asking parents to take an active role in the educational agency of their child. Exactly what is your child learning? What has your child lost over the last 2 years? And what can you do to help get them back on track? And that's going to be kind of a lifetime of work, because we understand that when children fall behind 1 year, it takes at least 2 years to pull them back up. And if children have 2 years where they're continuously falling behind, in some instances, they may never catch back up. So parents have to get involved now and make sure their child is on the track to wherever you want them to go. It doesn't necessarily have to be college. I do not believe that college is for everyone. But in terms of figuring out the next step, where is your child going beyond 8th grade, beyond 12th grade? What is the plan? And then get them started on that plan. What exactly are they working with in terms of a trade? Are they working with their hands? Are they looking to become scientists, engineers, doctors, lawyers? What else are you preparing them to do? So education is one. Second is something that the good doctor mentioned about the health of your child. Are you making sure that your child is back in there seeing their primary care physician? Are they seeing their pediatrician? Are they getting their dental checkups? I know that we have had this pause for 2 years, but we need to get back on track when it comes to health and wellness. Get back in there with that doctor. Get back in there with that dentist. And then also, if your child needs it, and I know this is, in the Black community, is hard things to say, but how is your child doing psychologically? What the doctor said about suicide rates, particularly among young African Americans, they are skyrocketing right now. Our children are dealing with great levels of depression. And though it might be hard for us to accept, you need to think about whether your child needs to see someone and talk to someone. And sometimes that person may not be you. But what is happening with the mental health of your child? So education, that mental and physical health of your child, and then what's happening socially and culturally. Someone mentioned about how you get in your car. Mr. Money said you get in your car and you put your phone on, you get your waves. Well, we understand that what's been happening for the last 2 years, to the nightmare of some parents, is our children have gotten completely attached to social media. So social media is driving their life, not just for them to educate and be moving forward, but I'm thinking about TikTok and Facebook and all these other ways in which they are taking over the minds of our children, getting the phone out of their hand and getting a sense of what your child has been feeding on for the last 2 years, because we understand that whatever sickness is out there, we can put up a door in front of our house, but if they have a phone and they have a computer, that sickness is getting in. You got to take back control of that, parents. You got to cut off the Netflix, cut off the TikTok, put some blocks back on these phones, and take back control of your household. Because if you don't do it when they're young, you're not going to be able to do it as they get older. So those are some of the areas I think we have to think about. And I would be remiss, Brother Eric, if I didn't say that we also need to think about the spiritual health of our children. I think it is important. Are you sitting with your child? Are you teaching them how to pray, how to meditate, how to sit in silence? Are you teaching them how to listen to themselves, how to trust themselves? Are you teaching them how to block out the voices that seek to do them harm? You can do it even when they're younger. It's important when they're 7, but it's equally as important when they're 17. So these areas of dealing with the entire child will also help work against the ACEs that my brother mentioned, because part of the ACE study is that parents are disconnected from the lives of their children, feeding into them, getting hold of them, and pulling them back on track.
Now let me ask a follow-up to that. Now, we've put the onus on parents, educators, mentors, and others, individuals. But let me ask you, Dr. Whitehead, what institutional changes need to be made or advocated for?
Well, we live in a society that's based upon a foundation of systemic racism. If I were to go the Dr. King route and the Ida B. Wells route and the Dorothy Iha route, we need to dismantle this entire racist and sexist and classist system, because as long as it's in place, Black folks are always going to be behind. But given that that's not going to happen anytime soon, we have too many Black folks who are helping to hold up racism rather than tearing it down, then systemically what we have to do is get out and vote people in office who are both skin folk and kin folk. Because we keep giving up our power in hopes of getting small incremental changes, and all we're doing is crawling when we really should be walking and running at this point. So you've got to be able to vote. Everyone's talking about voting rights and they're so concerned about losing it. That doesn't explain why we had so few Black folks who showed up to vote in the last election. Not just to put Biden and Kamala Harris strolling to the White House, but are you participating in the midterm elections? If you want systemic change, then voting is a way to get us there. Getting involved in public service, showing up at the community meetings, finding out what your city council person is doing, holding your mayor accountable, your state's attorney accountable. If we want change, then we have to be the change. We're not going to be able to tear down this racist system because too many folks believe in it, too many folks hold it up. Then what you can do is start with your block, your community, your city, your state. Do the change there, because that will put lights on your block and that will change the schools.
We have some time, so I'm going to open that question up to others on the panel. What institutional changes do you see that need to be made or advocated for? If you have anything specific to add to that?
I think Dr. Whitehead hit it, but you also got to see how we can impact policy. So we have those who are working on the front line, but we also need those who can help us to reshape policy on a local level. I always say this: all politics are local. All politics are local. See what it is that those policy changes that can be impacted locally to change or better the life outcomes for the individual subset that you're trying to impact. So we have to look at policies and how they were some policies hadn't been changed over the last 20 or 30 years. And we must, realize in our municipalities or at our state or at our state level government that these policies were written during a period of time where, the population hadn't shifted. So now the population has shifted. Policies need to be looked at on an annual or 5-year basis to see how things have changed so we can reshape policies to impact communities.
Okay, any others?
I would say policy, but also combined with research. There's a thing called community-based participatory research. And basically what this aspect is, we take researchers who are either a part of the community or working directly with the community members and seeing what issues and problems are most affecting that community at a particular time. So if we have bigger funding for research and we have more researchers that were dedicated with social justice and improving health disparities within the Black community, we'll be able to improve the health disparities on a long-term basis. As one of the panelists have already talked about is COVID. And thinking about the ACEs and early childhood adverse experiences, it's not something that just occurs when a child is 5 or 6 years old. It continues all the way up into adulthood and as an adult as well too. And everyone has been impacted by COVID-19, and our mental health, our physical health is all interrelated. And moving forward, we're going to see different trends in health disparities as attributed to COVID outside of just having the disease itself. And so it's important to incorporate research within the policymaking process so that moving forward, everyone will have access to improved health outcomes.
Thank you, thank you. I know we mentioned policy, and I can't help but just think about and add my 2 cents in there about land use policies and looking at land use policies in communities where, in terms of zoning, that affects what kind of businesses and what kind of businesses and groceries are in communities, what kind of neighborhoods are set up in terms of which. If we're having a lot of if the zoning is set up in a certain way, you're not going to have grocery stores. You're going to have takeouts, and with takeouts, you have loitering, and with loitering, you have crime, and so it kind of just barrels out of control, like it's a domino effect. So when we talk about policy, those are localized policies, saying that all politics is local, and it's a local policy zoning. So that's something that we all should, I think, should probably be looking at. So let me throw this question to Dr. Okonye. From your experience in emergency medicine, what can be said as to the importance of nutrition, and this kind of ties into what I just said, or malnutrition in young boys' lives?
Well, one thing that Dr. Whitehead was definitely pointing out, if you hadn't noticed, is, the need for consistency in the home. When it comes to nutrition, when she's saying you need to know, what is your child learning? I say you need to also know, what is your child eating? Having dinner every night, creating a space that is able to show your child what they're supposed to eat, and also give them an opportunity to have an environment in which they feel comfortable knowing that they are getting nutritional food, and they also have a place to, speak their mind. When it comes to the emergency room, we see things like diabetes. We have teenagers. I've had adolescents, kids maybe the age of 11, 10 with signs of pre-diabetes. They're overweight at the age of 10, 11. These are things that this is a habit that has started early that is going to be hard to break as they get into adulthood. That's why nutrition is a very important thing starting early. And it honestly starts with the parents and the family, because at the end of the day, a child can't purchase what they're going to eat when they're 4, 5, 6, 7. The parents are responsible for what that child's eating. So for me to say it's very important for children to have nutritional meals, I can't leave out it is important for the parents to have nutritional meals. You're talking about the zoning, that contributes to food deserts, places where families aren't even able to get the appropriate nutrition, which then leads them to developing things like high blood pressure, diabetes, heart disease, which then leads them going to the emergency room more frequently. Like Frater Nassim mentioned, COVID-19. disproportionately affecting Black people because Black people already had higher issues with those diseases. And it starts young. I mean, if your 10-year-old doesn't know portion control, doesn't know I need to eat some fruits and vegetables, doesn't know I can't eat McDonald's every day, what do you think is going to happen when they are now a teenager and can go buy their food? Or when they're in college and they're not forced to work out and they're not forced to watch what they eat? At the end of the day, I know we see a lot of things in the emergency room, but there are things that we see that are directly related to nutrition. And there's also malnutrition. You know, if you're not being fed well, your bones are weaker. If children are hungry and they're tired, they don't do well in school. Behavior problems are now shown. We see those kids in the emergency room who are being brought in for behavior problems, when in reality, they don't have a good home because they're either not sleeping well, they're not eating well, they're tired, they're hungry. They don't have the vocabulary to express that they are hungry, so they are acting out. So at the end of the day, I mean, it's a community effort to make sure that our children are healthy, that our Black boys are getting the nutrition that they need so they can be successful, so they can focus in school, so they can think about things outside of, like Dr. White had mentioned earlier, about, you know, not just sports, but other things. I mean, even becoming a nutritionist is a career path that our kids can go into. So from my experience, it's just very important that we all recognize that, I mean, health is important for all of us. And if we want our children to be healthy, we have to make the effort to be healthy ourselves.
Definitely. Thank you, Dr. Cognier. Mr. Mundy, we know some young college students are watching this live stream. So how can a young person enter these various fields with the knowledge of the disparities and be effective trying to make a difference?
So there are a couple of things. I think number one, what college students have to understand, that they are still a part of our village, where they may not be in the states or attending school in the states where they are originally from, but I want to encourage and challenge them to find ways to get involved wherever they're spending the majority of their time on their college campus or where they have moved on to. Secondly, find ways to share what you have learned with others, or the knowledge you have gained, and find ways to share it with others. Find ways to better things. And I even think, as far as adults, as older, I'm gonna say, seasoned, give college students an opportunity to share what they have learned. A lot of times they feel isolated because when was the last time you asked a college student, hey, what you learning? What are you learning? Do you mind showing or demonstrating some research that you've done? We have to find ways to give students an opportunity to share what they've learned. We send them to these wonderful universities. They're having wonderful times. We kind of keep up with them via social media, but we want to see what they're actually learning in some of the classrooms, some of the research that they're doing. Make it a priority for them when they visit back to some of the areas where they're from, to share some of that knowledge and information with the greater community, so that the community can feel proud of how they've supported them on their college journey. And when they graduate or post-graduate, it shouldn't be our expectation that they return to some of the communities in which they were birthed out of, but encourage them again to get involved wherever they decide to make home their home, to ensure that they are going to make a community that reflected where they came from better.
Thank you so much. At this time, I want to move to some questions we have from our audience. And if we can have one of those questions on the screen. Dr. Okonye, are there ways we can ensure that we're having more meaningful conversations with our Black boys and men at home?
It's like I said earlier, having a consistent space in the home. If it's dinner every night that you guys get together, talk about these things. One day a week, just creating an environment where your son, your other children feel that they can come and talk to you without judgment. I think I've had times where children in the emergency room have told me things that I know their parents don't know. And it's helpful for me in the moment, but I'm not going home with this kid. I'm not taking care of this kid. I can't change anything outside of what brought him to the emergency room that day. And that is where, and even pediatricians, as great as it is to have your primary care physician, that's still one moment in which they see your child. Whereas day in, day out, you are the ones that help shape their worldview. You help shape what their opportunities are. You help them know that if nowhere else in the world people are going to listen to them, at home they have a place that someone's going to listen to them. And something like that is very impactful on their mental health, because if you feel like you can't talk to your own family, then who are you going to talk to when you are stressed out, when you are worried, when you're concerned about food, when you're concerned about school? I mean, I've had kids who come to the ER who have had pain for days but never said anything to their family. So by the time they come to me, it's much worse than it could have been if they had come in maybe 4 or 5 days previously.
Thank you. Anyone else want to add to that?
I'd like to add to that. Thank you so much, Dr. Conye. I definitely agree. I just wanted to offer just a couple of other things that we did in our household. We had a word wall for our sons. And so we would spend time learning a new word every day and put it up on their word wall, and then encourage them to use the word. And we ride into school in the morning, they had to use the word in a sentence with me. They could use it when we got back home, but they were adding words to the word wall. We also had reading Saturday. When we were growing with our boys, we did not have television in the home at all. And so our sons grew up without ready access to that teacher in front of them called the television. And instead we got them library cards, and we would let them go to the library, and you can get as many books as you want, get you a snack, and get you a reading corner, which is probably why my oldest son is an English major today. Like, we made them fall in love with reading. We would also have kitchen table talk, so that when we sat around and we had dinner, someone had to bring a topic to the table, something you read, something you heard, and then we can talk about it. We encouraged our boys to debate us, that if you have an opinion, then it is yours. It's your job to defend your opinion, that yes is not the only answer, that you learn how to stand firm on what you believe in. We had them write books reports, like find a book you like and do a simple report, and then give a presentation to the family, because we want to listen and we want to spotlight you. We would have them make up songs. I mean, it was about finding space. My oldest son is a baseball player. My youngest son is a fencer. And so we would show up at the games. And I am the mom with the t-shirts with their name on it, which cost, $5 or $6. But we would have the whitehead tee, which, by the way, we still do. And we embarrass our sons today. But we showed up. I do want to add, though, and I think this is very important, that we have to talk about being economically advantaged to a point where you can show up because you get off work early, or you can make a place to have dinner, that it is an economic advantage. It is a point of privilege to say we're going to have dinner every night together. Why? Because we have table, the electricity's on, and we have money to buy food. We have to be clear that there's some parents who want to do this, but because of their economic situation, they're working 3-4 jobs. The lights aren't on. They can't get home to have dinner with their child because they're going from one job to the next. So I definitely don't want to shame those parents who really, some of them are doing the very best that they can. And then the final thing, and I was sharing this with President Freeman Rabowski from UMBC today. He was laughing at me. But with my sons in college, college sons will call and ask for money all the time, probably college daughters as well. And my thing is, you call, you want $20, $100, $150, not a problem. I will cash up you all day long. But first, tell me something I don't know. So find a book, find an article, tell me something I don't know. Show me how my money's being used. And if you can tell me something I don't know, then I'll cash app you. Hey, you want to be incentivized? Do it for the money. Because what we're doing right now is we're trying to get you to pour the knowledge into yourself, invest in you as much as I'm investing in you. So those are some of the things that we've done all the way through their life to where they are now. And both of them, by the way, are 3.8 average students who love reading and who are working hard to get to where they need to be.
I'm so glad you brought up that economic piece in terms of we don't want to shame people, because we're talking about nutrition and eating right. And one of the big things is why we're eating so badly. And a lot of Black families are eating so badly. It's because The inexpensive, the bad food and the worst food is the inexpensive food. That's the processed food. Many of us don't understand about grocery stores and how to shop the perimeters, right? And avoid the aisles, because the aisles have all the processed food. Every time I go to a grocery store, I kind of cringe when I'm in our community and I'm going to the community grocery store and I see a single mother with a grocery cart filled with like oodles and noodles and all the high sodium stuff. And I know it's cheap and I know it's easy. And then all the sugary drinks. And then I see the kids that are with them and they're morbidly obese. She's morbidly obese. And I want to say something, but I can't. You know, I want to direct them because even when I was coming up, I didn't know better either. I'm sure my mother knew some, but not all. I mean, many of us didn't know that we shop the perimeter, right? So that is I think that's important that we kind of push out there that we've got these food deserts, we've got issues with nutrition because they're being sent to the takeout.
Yeah, I mean, at the end of the day, it's all we can do is ask that people try the best that they can. I mean, if it's the majority of your meals aren't healthy, maybe start one meal. Something's better than nothing. Trying to take the stairs some days instead of taking the elevator. Just little things are better than nothing. So yes, we all know Whole Foods is expensive. Like getting fresh fruits and vegetables can be expensive. That liter of Coke can be more expensive than that purified water. It's unfortunate that's the world we live in, but you gotta do what you can where you can, and at least just the idea of being health conscious might make you think, all right, maybe I don't need that second plate. Maybe I just drink more water. Still, if you want to drink soda, I advise against that. But if you still want to drink soda, just drink more water too. Just, decrease your sugar intake, increase your water intake. Little things like that go a long way.
So let me ask this next question. This is to any of our panelists. Where would you lead a parent seeking support and guidance to support their Black son better? And that's to any of our panelists.
I'll take a stab at it. I think number one of the things you can do is build a positive support system around you, whether you're a single parent household. So identify the things that you feel that your son or the vitamin that they need socially, emotionally, and academically, and surround yourself with a support system. Two, find what engaging programs that you may feel that assist with mentoring or tutoring with Black boys. And third, build a cultural library for your son. And these are books that have positive images of them on the cover and that tell positive stories about Black boys themselves. Three, when we talk about what college students can do, here's an opportunity. College students, I need them to know this. You don't have to be a parent to be involved. You can get engaged at all levels to support. So maybe connecting with that local university that has a diversity program on campus and find out if there's any mentoring opportunities for Black boys on that campus, because most college campuses have some form of mentorship program on their college campus where they can partner your son or your nephew with an African-American male student and expose them to, it's either higher learning to their major, whatever they're doing positive on that campus. And then maybe ask what's in the community that's available to provide support and enrichment for your son. I would this shameless plug, Project Still I Rise, we've been providing mentorship programs for African-American boys over the past 15 years. So if there's ever a parent who's listening who needs to connect, and if it's something that we can't deal with, then we have a national network of other organizations and resources that we can plug parents into.
I would add a few things as well, if I may. One, and I kind of just spell it out, but I would say one is to talk with your son. not to your son, not at your son, but with your son, which means that you're talking and listening to them, that you are giving them space to spend some time thinking about what they want to say. I encourage parents to get to know their child. Is your child, your son, do they think and talk at the same time like I do? So I can ask you about your day. My oldest son thinks and talks at the same time. I ask him about his day, and I'm going to get just, 20 minutes straight of everything from what he didn't like to what he did to every teacher's thing. My youngest son is different. He's a lot more reflective. He has to think about it, and then he has to share. But I had to know that about him, so I can just sit in silence while he's thinking through my question and give him space to answer. Second, I would say to learn how to laugh with your child. Or are you just spending time just hanging out with them? Because a lot of times when I interact with young people, they're telling me things, oh, my parents don't even know that. Why not? Because are you hanging out with them? Whether it's playing video games, watching TV, going for a walk, thinking about Dr. Conye, that physical exercise. Are you raising pets and plants together? Like, are you doing something other than you are always a disciplinarian coming down on them on what they're doing right and wrong? And then finally, which was a big one for my husband and I, we put this group together called the Family Fun Group. What we did when the boys were younger, we looked in our church for other, and we looked for particularly for African American parents who had sons right around the same age. And we're like, okay, why don't we start this family fund? 5 other families we work with. And we would get together once a month at somebody's house. The parents would cook, the boys would play together. It was some girls as well. We would sometimes travel, but we built them a network of support. And what ended up happening is our boys begin to look at all the other fathers as uncles, as a support system, as a network. It also meant we could check each other's children, right? So if you see my child, if you see my son doing something, if you're there and I'm not, I need you to lean in for me because I can't be everywhere. And so we begin to do that, and that network has continued even while the children have gone off to college. We're all checking on each other's children. Like that idea of the village, it does work when we create the village and we are massaging the village and we know who's in the life of our children.
Thank you so much. Dr. Okonye, as Black men, what are some of the questions we should prioritize when talking to our primary physician?
I think Brother Jeffrey's on mute.
Can we unmute Dr. Okonye? Can we unmute Dr. Okonye, please?
You've got to unmute yourself, brother.
Brother Okonye, you need to unmute yourself. Brother Okonye, you need to unmute yourself. It's still locked. Okay, so let me, I'll come back to you, Dr. Okonye, Brother Okonye, I'll come back to you. To the panelists, the rest of the panelists, can you speak to the effects of social media on the Black male image? Who would like to take that first?
I will take it first. In addition to being a mom, I'm also a communications professor. And so I teach about social media. about how to use it as a form of advocacy. I look at social media for social justice, the ways in which the Black Lives Matter movement was birthed on social media, and then it was built by social media. I also teach about the dangers of social media and what is reflected back at you, and the need to want to put everything about your life on social media and to open yourself up for that type of abuse and attack. I say that knowing that I walk a very thin line, because I am a radio personality. I have a very big social media platform, right? So I'm on the social media and I'm putting everything there. And so I have tried to teach my boys about what belongs on social media and what doesn't. One of the things I know that I did do with them, that I learned, that at some point, when they were young and 3 and 4 and 5, you post and like, oh, my child is 9 and got this award. And then the older they got, as I started to think about your social media footprint, how deep it is and how much you are on the internet, thinking about asking for permission before I, as a parent, posted about their life. And I actually I post very little about them now that they are, when they got into 11th grade into college, but helping them to navigate social media and helping them to figure out who they are, since they are developing two personalities, right? You have your social media personality, and then you have your life outside of social media. How do the two line up to each other? And then helping them to realize and recognize that once it's on social media, it's forever there. What about long-term jobs? What about your long-term, your relationship with other people? What about your career aspects? What about your reputation? That these pictures you put on today of you at a party getting drunk and falling out are pictures that might follow you for larger things you want to do in your life. So I think about both the dangers of social media, but also the benefits of it.
I just want to add to that. I think something to always remember is your digital footprint, and learning how to leverage social media for the positive aspects of what you're doing in your life. As Dr. Whitehead said, is something that doesn't automatically disappear. There's this thing called cyber forensics, where you can go behind the firewalls of the firewalls and find information where you've posted indirectly or directly towards someone that may have adversely impacted their life. So, I think some of the images out there, we went through this period of social unrest, and still going through this period of social unrest, and then probably angry and upset of images that we saw across the country, and utilized, social media was utilized as a place to vent your frustrations, or vent your emotions, or let your feelings be lashed out. And even with some of that, you had to be very careful of what you said and how you said it and who you said it about, because that digital footprint is something that can be life lasting, and could also be utilized against you in terms of employment, or in terms of maybe promoting to another opportunity. So people will use it against you for the bad, and not for the good in all segments.
Brother Frater Ashford, do you have a comment on that?
Yes, also Mr. Mundy touched on it a little bit with mental health. I think social media plays a very large role in the perceptions and identity of how Black men and how Black boys view themselves, especially in the age of celebrities. And you have like high fashion and designer, all kinds of different things. And you normally see what's trending on social media. And so by not having access to the things that you see on social media, you think, oh, maybe it's something wrong with you, or maybe something that you have to do to address in order to fit that status quo, which is being fueled by what we see on social media, the trending topics and things like that. So I would think when using and utilizing social media, it's always important to remember that it's not real. It's only a perception. We all carefully curate what we want to put out there to the world. And it's by not remembering that it's curated and it's fictional and it's just a picture. It's not reality. It begins to distort our image of what reality is.
Good point. Good point. Dr. Okonye, do you have a comment on this?
Oh, as far as because I believe the question was social media effect on our Black men.
Yes.
Yeah, I mean, I think, I was having this conversation with my wife the other day. We live in a world where you can see everything that you want to be and compare it to every place you're not every day, all the time. You're in this place where if you want to be a great, athlete, musician, scientist, doctor, you can get on Instagram and you can see it, which can be good because it allows you to see people who look like you. But it also, unfortunately, for some people, can enforce the narrative that they aren't good enough because they are constantly comparing themselves to all this stuff that's being posted that's photoshopped or doesn't include the true story. And I mean, we see that with the pandemic and with social media. We just see behavioral health cases continuing to rise in the emergency rooms. And I mean, I haven't looked at any studies personally, but I can't help but notice that with the rise of an app in which you get feedback from likes and comments, you change a little. I mean, I'm sure all of us can think about a time we posted a picture, it got 15 likes, and you're like, dang, it only got 15 likes? I thought this was a good picture. And for a lot of people, that could be a normal situation where you're just like, all right, I mean, it's not that big of a deal. But for the adolescent mind, that can be crushing. And for Black boys, when you see things in the media that constantly reinforce this negative narrative of who you're supposed to be in society or how people see you, sometimes it's hard to get out of that and figure out where you're supposed to be when all you see is how all these other people see you.
Now, Dr. Okonye, let me jump back to a question that I asked before we had some technical difficulty.
Yeah.
As Black men, what are some of the what are some the questions we should prioritize to ask our primary physicians?
One is, what kind of screenings are you supposed to get at what age? I mean, when it comes to children, it's kind of pretty standard across, what we're supposed to do, when you're supposed to do it. And a lot of times people have to bring their kids to the pediatrician anyway to get vaccines for school. And so those are the times where pediatricians are looking at the weight, the height. And then as kids get older, asking them one-on-one, what's going on in school, what's going on here and there. But as you get older, you kind of have to start advocating for yourself a little bit more, asking what kind of screenings am I supposed to get? If you know your family history, asking doctors, hey, this runs in my family. Should I worry about this in my child? I have these health issues. What are the likelihood of my children having these issues? Kind of things like that. I mean, some of it, we can help you a lot, but some of it, we don't know everything about you. And so it kind of puts a little power in your hand to help control and direct the direction of your healthcare.
Thank you. So, what are some of the most important trends? And our audience member says trends. I can say symptoms, things to look out for that we should pay attention to with our Black men and boys. That we should bring attention to a medical professional, um, even a mental health professional. I would say.
I mean, certain things like, if you notice your child, there's an activity they used to do all the time, and then now they're not doing it as much. You see their grades are slipping. You notice you had a child who's really talkative, now they're not talking as much. Just behavioral changes. Your well-behaved child is now not behaving normally. Kids who were previously potty trained, who are now wetting the bed. Those are things that you have to look out for to figure out, is there something going on mentally or physically? Those are little, you really have to pay attention to your child. And that's where it also comes into play, those appointments with your primary care provider. Because in the emergency room, this is my picture of you today. I've never met you before. I may never see you again. But with the pediatrician, they have your growth chart. They can see where your weight's tracking. Are you gaining weight appropriately? Are you losing weight? They can They can notice when they're asking these questions about your diet, about school, about your friends, about your hobbies, if anything changes. Because like I've said before, I have things that children will tell me that they will never tell their parents. But when we bring things to light, I have parents say, I didn't notice that they stopped playing games, or they stopped hanging out with their friends, or they've been in their room a lot more. Just little things like that. I mean, parents say it all the time. Parents say it to me all the time when I'm trying to give advice. I know my child better than anybody. So it's like, and that is true. I can't tell you what your child's doing day to day and things of that nature. That's where us as physicians need your help to help figure out how's your child doing in school. Because if your child telling me he or she's doing well, and I talk to you and you say, no, they're not, then that's a conversation we can try to figure out. Why aren't they doing well? Do they need more counseling? Do they need more tutoring? Do they need just more attention? What is going on in their life that's kind of getting them off track? Because unfortunately, when you miss these things and kids start going down the wrong road, there are unfortunately some decisions that children make, like Brother Nasir mentioned about, the 1 in 3 boys getting incarcerated. There are decision points in which you make a certain decision. Unfortunately, there's no coming back from that. And our objective is to help prevent you from getting there.
Thank you. I want to give everybody a chance to offer some really brief closing remarks. Who would like to go first?
I'll go first. I would like to encourage everyone to link up with all of us. Join this awesome research. It's not only a benefit to yourself, but it's a benefit to others, to your children's children's children. This awesome research on just you as an individual can impact so many. Continue to find ways to get involved locally in your community, either through mentorship or through support for another parent, through your church or through your fraternal organization or through your small group setting. And in my closing, always remember your health is your wealth.
Thank you so much. Let's see. Frater Ashford, do you have some closing remarks?
I definitely agree with you, Mr. Mundy. Your health is your wealth. And in saying that, I think it's important for us to really tune back in with ourselves and get to know ourselves, get to know what foods we eat might affect our stomach in a certain way, get to know when you wake up in the morning and you say, hey, I'm really just not feeling good today. So just take into account all of the different things that are impacting your health on an everyday basis. So that way you can become more aware, you can become more literate. So when you do go see the doctor, you know how to describe the different issues and things that are going on with you, and just to reprioritize yourself and your overall well-being.
Thank you so much. I'll go to Dr. Okonye.
I would like to say just once again, healthychildrens.org. I mean, it's a great website from birth to late teenage years. Has answers to questions about feeding, sleeping habits, nutrition, workouts, or physical fitness rather. Just making sure that at the end of the day, it takes a village, and just ensuring that you are putting your children in the best position for them to succeed. You are taking accountability for your health, your child's health. And I just want to empower everybody. Ask questions. Our job is to answer your questions. Don't be afraid of asking a stupid question, because at the end of the day, the only stupid question is the one you didn't ask. So I just want to encourage everyone again, when you see a physician, ask your questions and we will answer them. That is our job. We are here to help you be healthy.
Thank you. And last but not least, Dr. Whitehead.
Yes, in taking care of and raising our young sons to protect them and propel them forward, I want to turn it back on the parents. Like, you got to take care of you. Like, do you love you? Do you like yourself? Because I found that as a mom, the more I enjoyed what I was doing, the more I supported me, the more I took care of me, the more rest I got, I was a better mom. I loved my children more. I supported them more because I liked where I was in the journey. And so I encourage parents, hey, fall in love with yourself first, because you can't give anything to your sons if there's nothing left for you. Are you getting your checkups? Are you okay psychologically? Are you okay when it comes to your emotions? Because the better you're doing, the better mom or better dad or better caregiver you can be to your children. They need you to be okay too, so you can help them and model for them what it looks like to be happy and healthy and to be moving forward.
Thank you so much. I'd like to take time to thank all of our amazing panelists, Brother Mundy, Brother Dr. Okonye, Soror Dr. Carsonia Wise Whitehead. Thank you so much for this amazing dialogue. I think it's been very enlightening and informative. I know people are going to have a lot more questions on this, and so I'll probably be pushing some questions to you, because I'm sure we're going to get questions from our listeners out there after this this webinar or whatnot. So thank you so much. At this time, I'd like to pass the mic over to our brother Arthur Gregg, who is going to offer the final closing remarks for the program. Thank you again so much.
Wow. I am just sitting here in amazement. This has been an awesome opportunity for us to learn, to grow, to share. Special shout out to Frater Ashford, our graduate student who you'll see more of. And I want to thank the All of Us Research Program, the Black Greek Letter Consortium for just bringing us all together. But it's not over. We will continue the conversation on cultivating men of distinction, addressing the social determinants of health for Black boys next week, on next Monday, January the 24th, same time, 6:30 p.m. Central Time, 7:30 Eastern Standard Time. We'll be talking about education, access and quality, and economic stability. So you don't want to miss that, and you definitely don't want to miss seeing Frater Nassim Ashford, who will be back with us on next Monday, January 24th. The flyer is on the screen, so definitely if you enjoyed tonight, we look forward to seeing you next week. We also want to share a save the date. A save the date is for our Rooted in Resilience tour, which will be in Dallas, Texas, February 25th through the 27th. It is a weekend of college, community, and church. For more information, the information is on All of Us website. The Rooted in Resilience tour is amazing. It's an amazing opportunity where we're partnering with our Black HBCU here in the Dallas-Fort Worth area, one of our local community groups, and one of our local Black churches. But last but not least, please don't leave, because guess what? I told you in the beginning that we did our pre-assessment survey. Now we need you to complete the post-assessment survey. We got to close it out. And this is what closes us out. Again, we thank you for taking the time. Click on this QR code and fill out that post survey. Again, thank you to our panelists, to our moderator, to Brother Dr. Eric Webb, who set the tone of this program. We appreciate all of you who took the time to be with us tonight. Hope the dialogue, you took away some great information, opportunities. Again, we look forward to seeing you next week, January 24th at 6:30 p.m. Central Standard Time, 7:30 Eastern Standard Time, where we'll have more same platforms. We'll be on the NPHC YouTube and Facebook channels. Tell your friends about it. We want to see you and hear more from you. So I'm going to be quiet now as we close out this program and let you fill out that post survey link. Continue if you have other questions. If you want to drop them in the chat, we will definitely get them to our panelists. And I'm sure by now you're filling out that post survey. The last word you will hear from me is, it is easier to create and to build strong children than to repair broken men. That's why this conversation on the social determinants of health for Black boys is so important. We look forward to seeing you next week. Thank you.
What lies inside all of us is more than data, it's life. What's flowing through America's veins is its diversity. And it's those very differences that will lead to answers for generations to come.